So hi everybody and welcome to the first GDI webinar of 2021. I'm Rory Horner, a senior lecturer in GDI, and I'll be the chair of this session. Just a couple of housekeeping rules before we begin. On entry, everybody is muted, and we just ask you to stay muted until the end of the presentation to prevent any background noise. The presentation is being recorded, but only the speaker will be recorded. So it's up to you whether you turn your camera off or not. If anyone has a question, please save them until the end. There'll be plenty of time for Q&A. We're really looking forward to the discussion. You can either raise your hand when it comes to the discussion using the blue hand, or you can also write a question in the chat. So it's a real pleasure to have Professor Susan Sell here for today's GDI webinar. Susan is joining us all the way from Canberra in Australia, and where it's about 9:34 p.m. at night. So we're really glad she's working late to be able to share her recent work with us. Susan is a professor at the School of Regulation and Global Governance at Australian National University. She has a PhD in political science from the University of California at Berkeley. She's really well known for her work on intellectual property rights and the political economy of IP and access to medicines, especially her book, Private Power, Public Law, The Globalization of Intellectual Property Rights. And she's served on a whole variety of different areas in this field, and including on the United Nations Secretary General's high-level panel on public health and access to medicines. So she is incredibly well known in this field, and it's a real pleasure to have her here today, where she will be talking to us about what COVID-19 reveals about 21st century capitalism. Susan, welcome.
Thank you, Rory. Thanks for that really nice introduction. And I wasn't on the high-level panel. I was a member of the expert advisory group to the high-level panel, just to clarify that for the record, you know, taking it down a notch. But yeah, it was a very exciting project. So today what I want to talk about is what COVID is a really good opportunity to think about global political economy and what's changed in the 21st century versus the capitalism, what we refer to as neoliberalism of the 1970s and 80s, Reagan and Thatcher era. So I'm going to be talking about that today. There is a paper that's going to be put up on the chat room. It's an open access paper that was published in development, and that'll have all the citations and more detail that this talk is based on. So I'm going to go ahead with my slides. So talking about COVID and capitalism, first I'll do a brief introduction and then talk about what's new in capitalism and what I call 21st century capitalism that sets it apart from the broader way we talk about neoliberalism as being about privatization or deregulation, globalization, those things. There's some specific features, I think, that have come home to roost in a negative way in the case of COVID. I'll talk about inequality and poverty, which is obviously part of the story, and then more specifically elements about capitalism that are impacting COVID-19 and problems with responding to it. So what's new, I would say, is in 21st century capitalism versus what we got used to with Reagan and Thatcher and, you know, free market and shrink the regulatory state, is financialized capitalism, which I'll explain in a minute. Vertically integrated global value chains, and I will show you the smile curve that helps to explain the dynamics of those. The dominance of intangibles in the economy, and by intangibles, that refers to things like services, intellectual, complex financial instruments like derivatives and things that have been securitized. And they're very opaque and hard to determine what real market value is for those kind of things. So intangibles really dominate the contemporary capitalism. And I'll show you that again with the smile curve. And then another new feature that's concerned about now, as well as policymakers, is the degree of economic concentration. We really haven't seen this kind of economic concentration since the age of robber baron capitalism at the end of the 19th century. So those are some of the key features of what's new as opposed to the end of the last century. So under financialized capitalism, what this refers to is that profits accrue mainly through financial channels rather than through trade and commodity products. So what people are making money on are financial products rather than building better mousetraps. And I'll show you again what that looks like. But this is a big difference. It started out with the globalization of finance in the late 20th century, but now financialized capitalism has transformed almost every business, including non-financial businesses. And I'll show you what that looks like in the pharmaceutical and biotech sectors as I go along. So financialized capitalism was one of the new features of 21st century capitalism. And this GVCs and the smile curve, I think, is a really important way to think about the global economy and also the increase in inequality. So back in the day, the smile was not as steep as it is here. On this top end is the value added. So most of the profits and the value added go to the people that control these features of production. In the pre-production intangible activities, remember I said the big story is the dominance of intangibles in the contemporary economy. So in the pre-production intangible activities include things like innovation, research and development, and design. And almost all of these things are protected by intellectual property rights. And so these are at the top of the smile on this end are getting most of the profits, most of the revenue from what they are. These are the high value added activities. As you move through this value chain, we go down to purchases, production, and logistics. And down here is where you see labor. These are the tangible activities that used to, one could say at different points in history, used to dominate the smile curve. And labor used to, with unions, et cetera, used to gain a larger share of the value. So this smile used to be much flatter. The people with intellectual property weren't getting these crazy super rents because they weren't as protected as they are now. And the people that are now at the bottom used to get and other kinds of protections because unions used to be strong. And so what we have here is economic concentration, winner takes all economic contests. But at the bottom in production, we have very super competitive markets where everybody's competing to supply, like Walmart, for example, with low priced goods. So they're really cutting the cost of production so that they can be the most cost effective, cheapest supplier for places like Walmart. And also there's a lot of competition at this end to produce for companies like Apple. So if you think about Apple, that gets the value up here. And most of that value stays with the in the United States where Apple is located. It goes back to Apple's headquarters. Here, competition to produce for Apple. So in Foxconn, which I think is Korean owned, but they produce in China, they build an iPad and the workers only get pennies on the dollar for what it costs to produce it. So they get very little percentage of what it costs to buy an iPad. Oops. They get very little percentage of that, whereas Apple gets the lion's share of the value and the profit. Then we move back up the smile and we get to logistics is still low value added, medium added value would be marketing. But then we get up here to services and the picture's covering the word for me, I can't see. at any rate, but up here, oh, branding. So up here, that's again intellectual property, it's trademarks, services like the Apple Store, after, customer services for aftermarket, after they buy the product. So up here is where the lion's share value is added on the smile curve. So at these two top ends, the high value is all around intangibles. And the big point over time is that this curve has gotten much steeper. So the value up here is much higher, the value up here is much higher, and these at the bottom, what their value added or their returns are much, much lower. So labor is very much harmed in this scenario. So what we have as a result of that smile curve and how it's gotten so steep in the last 20 years is more economic concentration. And then you can see here income gains at the top dwarf those of the lower and middle income households. So you can see from this chart how, it corresponds with this shift to 21st century capitalism, steep increase in the returns to investment of this top group. Inequality and poverty, as Oxfam pointed out, that the top 1% controls 46% of the world's wealth. And as this cartoon says, it's still not enough. But this kind of economic concentration and inequalities become extremely stark over the last 20 years. It started with the Reagan and Thatcher years, but it's become dramatically higher over time. Since 19 equality income has gaps have roughly tripled, so that's big. Although globalization has lifted millions of people out of poverty, there's no question about it, especially in China and in India. The income gap has tripled, so the distance between the top and the bottom has just gotten so much higher, even though many have been lifted from poverty at the bottom. And I think with COVID, we're going to be going back. Many of the people that were lifted out of poverty are going to go back into it, like as happened in Asia during the Asian financial crisis. We see unequal access, preventable deaths with 800 maternal deaths every day that are unnecessary. In 2013, 6.3 million children under 5 died. In the United States, I believe it's 1 out of every 500 African Americans have died of COVID. If I'm not mistaken, it's been very unequal in terms of attacking vulnerable populations who are mostly Black and brown, and recent immigrants have borne the brunt of the death and disease of COVID. So inequality, power, and shaped by access to care and nutrition, which, those are all positive things, but it's also linked to generational wealth. It's linked to poverty and income inequalities within wider national and global structures of accumulation, like the structural picture I told you about, the smile curve. So it's really, you have to think about this in a structural way to really understand the way that COVID is playing out in these two populations. So what's new about capitalism and COVID and 21st century capitalism in particular is Wall Street capitalism, is what John Braithwaite calls it, which refers to financialization, and then monopoly capitalism, which I would call intellectual monopoly capitalism, like Pagano calls it. And so that's also led to the concentration at the top of the smile curve. So monopoly capitalism explains those too high concentrations of wealth based on ownership and control of intangibles. The owners of intangibles control those smile curves, that whole global value chain, and they reap the lion's share of the rewards. Now, ironically, when in the 1970s and 80s, when Reagan and Thatcher were talking about being competitive in global markets, and at that time in the United States, they were worried about competing against a rising Japan. Now it's China, of course, that everyone talks about. But the irony there was to be competitive in global markets meant actually a reduction in competition. And what I mean by that is in the United States, the policymakers became influenced by the Chicago School of Economics, which only looked at the effects of economic concentration on price. So if you had mergers and acquisitions, and it wasn't automatically going to raise the price for consumers, they would let that go by. And the thinking was, and the same thing was true in Europe with national champions in the 70s and 80s, is that if you allow concentration domestically, allow your firms to get really, really big and consolidate, they will be more competitive on global markets. And so this had the effect of reducing competition at home and allowing for mega mergers, allowing for banks to get too big to fail, allowing for all of that with the idea of being competitive on global markets. Because then if you're very big, you can dominate the world. And so that was an ironic consequence of the language of competitiveness, which I always felt was dangerous because nation states aren't firms, but to talk of them as if they were had these perverse consequences in terms of reducing competition and allowing banks that are too big to fail, for one example. So this has led to a lot of oligopolies. It's also led to a lot of oligopsonies, and those are people, firms like Walmart and Woolworths here in Australia, that there are very few places to sell your goods. Amazon has become an Amazon has oligopsony power, because if someone wants to sell your stuff online, you basically need to go through Amazon because that is the biggest platform in town. So you want to give your goods to Amazon for them to sell them. So this concentration of power in these smaller and smaller groups of entities, number of entities at the tops of the smile curve. What we also have at the bottom of the smile curve are jobless recoveries, because with the shift towards intangibles, these firms like Apple and what they want to do is they want to reduce their labor footprint. And so they have a lot more casual employment. They don't invest in real estate the way they used to when the bricks and mortar places. Amazon's another example of this. But at the bottom, you have jobless recoveries, and there's not much protections for labor. Union power has sharply reduced pretty much everywhere. And so what we have now is much more labor flexibility. That's a euphemism, flexibility and casualization of the labor force. And so there's much less job security, and this has had negative health effects, as we see in the case of COVID. So financialization has altered the behavior of non-financial corporations. And I think this is a really important feature of 21st century capitalism. So even if you're not in the business of banking or derivatives trading, it's altered your behavior. And I'll show you what this looks like in pharma in particular. It changes the incentives. Now much of executive compensation, CEO pay, is based on the value of your market, of your shares. So if you can boost the price of your shares, then your income is going to go up. For example, in pharmaceutical industry, anywhere between 80 or 90% of the executive's compensation is based on what the stock market price is, independent of firm performance in terms of coming up with a new drug or diversifying your markets or investing more in R&D. It doesn't matter in terms of your performance. It matters what your share price is. So that's really driving a lot of behavior, and the incentives are all around that now in corporate governance. So has become the metric on which you say whether your firm is doing well or not well. In the pharmaceutical industry, this has had very perverse effects. And it has also created bottlenecks around access to medicines and protective personal equipment. And in the cases of personal protective equipment, those N95 masks have hundreds of patents on them, and there are only 4 big producers of them. And a lot of them have gone the financialization route. They're produced in China, and the Chinese workers making them don't make a lot of money, but the intellectual property, the intangibles, are owned by Honeywell, 3M. There are about 4 companies that make these masks, and there have been supply chain bottlenecks around those because of the intellectual property, partly because of the intellectual property that is not being licensed out to have a whole bunch of people producing them at the same time, because we have an international crisis, a global pandemic. But there's been bottlenecks. Some of them are due to intellectual property. I'll give you another example. So financialization is all about your profits. It's not about even your growth, it's about your profits that you make. And there was an example in the United States where the United States government had contracted with a small company that was very innovative. They were making lightweight, easy to use portable ventilators for hospitals. The US government put a big contract out for it, and this little firm got it, Newport Technologies, I think it was called. And they were making ventilators that would have cost about $3,000 each versus the standard ones that cost about $10,000. Well, a bigger company bought, that makes the $10,000 ventilators, they bought Newport and they acquired them for a good price. But then they stopped production of those cheaper models of ventilators that were easy to use and portable, more easily portable. They stopped production on those, and they told the government, US government, that contract wasn't really a big priority for them anymore, and they were moving another direction. And other companies that had competed for that contract said that the buyer, this big company that makes the $10,000 ventilators, wanted to stop production of the $3,000 ones because it would undercut their market, because they were cheaper, better product, and they just wanted to stop production. So this can create perverse incentives for innovation and try to kill innovation rather than promote it and promote access and production of better, innovative for a global pandemic, for one. So here's just to emphasize how financialization changes the behavior of non-financial companies. Here's the traditional model of pharma and biotech. So in the traditional model, where a firm will use its profits that will reinvest to keep skilled employees, it will reinvest in the firm, it will reinvest in R&D and try to make better products, diversify, innovate. So in the old model, this traditional model, priority stakeholders were customers, which for pharma would be doctors, patients, and state agencies. For biotech, it was pharma companies and independent distributors would be their customers. The main product focus was marketable drugs. That was your job. For biotech, it was marketable or development stage drugs. And that was your product focus. And then your main performance indicator was your market share. What percentage of the market do you capture? What's the rate of growth of your company? Oops, I should say patents. How many patents do you have? Do you have new patents? And what's your new look like? Something's coming in, coming down the pike that you're going to produce, and you've got a bright future because you've got this innovative line of products that you're going to be rolling out over time. For biotech, it was also patents. How many patents are you getting? And then what are your new products? So those are the main performance indicators. That's how I can tell my firm is doing a good job. Under the financialized model, pharma and biotech is very, very different. They're not reinvesting in their companies. They're reducing what they reinvest in R&D, and they're not innovating the way they used to. So under this model, priority stakeholders for pharma are shareholders and bondholders. For biotech, they're pharma partners. Often new biotech firms, their big dream is to be bought by Pfizer or for a lot of money and just get out of the game. Other banks, equity and bondholders, other banks that hold these shares. And so the stakeholders are no longer the customers to whom you're delivering benefit, but are rather shareholders. So here we go, the power of intangibles and how that changes the incentives around firms and changes the incentives for executives running these firms. So the main product focus are retradable bonds, shares, retradable shareholdings. strategic shareholdings and development stage drugs for biotech, hoping that Pfizer's going to buy you. Main performance indicator then is your return on equity, your distributable profit to shareholders, and your share price. So it's not new products, it's not a pipeline of innovation, it's your return on equity. Same thing is true with biotech, except also the IPO valuation, when you want to go public. And then, you get your money and you get out. So it's a very different set of incentives versus even 20 years ago. So capitalism and COVID, I think COVID offers a lot of opportunities for us to rethink capitalism. One of the questions is, and it's very volatile and very loud right now, this conversation is who's going to be left to die? During the HIV/AIDS crisis that exploded in Africa and Asia and Brazil, in Africa, they were saying, who's going to be left to die? We're going to have to wait for these drugs. We don't have access to them. We can't afford them. And these decisions are going to be who's going to be left to die. That very conversation is going on now around vaccines, with Europe and the UK fighting over it. The World Health Organization pleading, saying, if we don't get vaccines out to poor countries, there are going to be so many variants of this disease, the whole world is going to die. So we have to think about it in a different way. But clearly, the questions of equity, the questions of who gets to the front to get those vaccines, who has advanced purchase contracts with them. It was all rich countries. So what happens when you're Bangladesh and you need vaccines? So the question who's left to die, I think, is really stark in the COVID situation. The question of vaccine nationalism is the German government ended up having to take an interest in one of its firms that was going to produce vaccine because the US was coming in and trying to write a big contract. And the Germans are like, wait a minute, if this is a German company, why doesn't any of this stuff come to Germany? So the German government took some interest in that firm. And then players like Bill Gates have stepped up, and he's invested a lot of money, and he's done some great work and been generous in investing in vaccine development. But I think it's a mistake to rely on philanthrocapitalism to solve the problems, because to me, needing philanthrocapitalism so badly tells me more about failures of public structures than it does about the wonderfulness of Bill Gates. And it's not something we can rely on to be sustainable over time. And it's also interesting that most of these philanthrocapitalists have gotten extremely rich and increased their fortunes beyond belief since COVID. So there's some real questions to be asked there, but philanthrocapitalism, we must not rely on that in the absence of doing other things that will ensure more durable, sustainable, and equitable outcomes. Another thing that COVID has shown us is about inequality and working conditions. The new risk workers now are primarily communities of color. They're the Precariat, they're recent immigrants. Their working conditions are completely unsafe. I've got, and the frontline workers, people who work in aged care homes, home healthcare workers, these have been disproportionately affected. People that stock the grocery stores, they can't stay home. They're wage slaves. I mean, they can't stay home from work because they have no health benefits. They don't have other options. They don't have family savings. They are usually supporting many people. They don't have the option of not showing up to work. They will lose their job. And so you can see that some of these conditions. Here's a meatpacking plant. Meatpacking plant they were ground zero for a lot of COVID infections. And some of the meatpacking plants were actually, that had so big outbreaks, were offering their workers $300 bonuses to come in and work anyway, which is, I think it's complicated, cynical. What's the cost of your life? Most of the people working in these plants are people of color, recent immigrants. Many are undocumented workers, and they don't have the kind of protections that other workers do. But there's no way that you can avoid droplets spreading in these factories. It's impossible. Here's another example. This is an Amazon fulfillment warehouse where they're working cheek to jowl. And one guy in New Jersey organized some protests against Amazon, saying they're not giving us masks, they're not giving us hand sanitizer, they're not taking any measures to make sure we're safe in this environment, which was a big spreader environment. They're not doing anything. And Amazon, Jeff Bezos was getting extremely rich during lockdown because everybody was buying everything online. And as this one protester said, money comes and goes, but health is irreplaceable. Shut down Amazon. And they were not providing equipment. They were not taking measures for social distancing, none of it. And these people are being paid minimum wage with no benefits. So one of the organizers of these protests in New Jersey, Amazon fired him. And I'm sure it was because he'd organized protests against these conditions. And then here's an example of a grocery store worker sanitizing grocery carts. So with capitalism and COVID-19, we can see globalization, economic interdependence, intertwined global supply chains, concentrated political power, and Wall Street and monopoly capitalism. They powerfully shape global political economy. And they've shown and they've revealed to us their malfunctioning in the face of a global pandemic. And they've revealed to us the true cost of this system for people. And so then we have to think about, so what are some options for reform? This isn't working, and it's not working for people on the bottom of that smile curve. It's working worst of all for them. So COVID-19, I think, gives us an opportunity to really rethink the system and really rethink the foundations of 21st century capitalism. First of all, we should ask about what's the risk-reward ratio. And there, I mean, the risk of that you take by investing in an innovation, by trying something, and then if you undertake something risky and it turns out to be profitable, who should get the reward? In fact, at least in the United States, and I'm sure it's true many other places, that most of the risk for COVID treatments and COVID vaccines has really been undertaken by the government sector. But Mariana Mazzucato calls it entrepreneurial state, has invested in science, has invested in National Institutes of Health. But then the rewards go to the Pfizers of this world and the AstraZenecas. And so the risk reward ratio isn't quite right because taxpayers end up having to pay for those drugs twice because the taxpayer money went into the development of them. And then the rewards all go to these pharmaceutical companies at the top of the smile curve. And part of the reason is that there's no transparency in their pricing strategies. How much did it really cost to make that Hep C drug? How much of that Hep C drug that they were charging $160,000 for a course of it, how much of that was really developed in a government lab or under a government fellowship or contract or money from the National Science Foundation? That is not made transparent. So it's really impossible to tell how much of that innovation, how much of that reward was really earned by the company that owns the patent. Again, we need to think about who's creating value in the market and who's extracting it. And, you know, is it right that the workers that actually assemble an iPad only get, 6 or 16 cents, 6 cents on the dollar, something like that. And Apple gets to extract almost all the value. So the top of the smile curve, maybe that needs to be flattened a bit more, reflecting creation of value. Also, I think this shows the need for banking and financial market reform. The GFC of 2008, the reforms after that have been very minor. The banks are still too big to fail. There's still many signs that global financial instability is here to stay until that situation gets resolved. If you look back at the period from about 1940 to, after World War II, maybe 1947 to through the 70s, pretty much the financial instability was within a band. whereas it's after the repeal of the Glass-Steagall Act in the United States that you start to see this real volatility in financial markets, and that really hasn't stopped. And so by creating a firewall between retail and commercial banking, like we had with Glass-Steagall in 1933, after the crash of the market, that stabilized banking and reduced that volatility. So I think it put between the bank where you go and get a loan to buy a house or something, and then the guys that are playing on the global casino, those activities, investment banking, I think a firewall between those would really go a long way. Also breaking up the banks. They're too big to fail, they're too big to jail, and it's not working. There's too much instability. I think it's also time to look again at antitrust or competition policy responses. As I mentioned, that in it was really the early 1980s, and Chicago School of Economics started just looking at price rather than market structure and determining whether this was anti-competitive conduct or had an anti-competitive result. Time to read that, go back to think about market structure, and the Googles and Facebooks and the Amazons of this world, regulators all over the place are trying to figure out what to do about the power of big tech right now. So the conversation is a lively one, and I think it's a ripe conversation to be having right now because of that concentration on both sides of the smile curve. Another issue is about treating essential workers as essential. It was funny to me, I guess, that nobody was talking about the bankers that fled to the Hamptons during the big New York outbreak, the original one. No one was talking about any of those guys as essential, but they were all talking about first responders and nurses and aged care workers. But we don't treat them as essential workers. We don't pay them enough money. We don't give them enough job protections. We don't give them enough of what they need to stay safe. And so I think we really need to rethink. It's revealed to us, I think, who really is essential and who we rely on, the people that stock our groceries, that make sure the pharmacies are stocked, who take care of our loved ones, child care workers, aged care workers. If they really are essential, we should start treating them that way, and they should be more highly valued. I think it's important, capitalism and COVID-19 shows us that it's really time to repair tattered social bonds. The whole libertarian ethos, especially in the United States, has done a lot of damage where people have forgotten that they're part of a community. And when people are staging mask demonstrations, anti-masking and don't wear mask and it's my liberty, they're only thinking about themselves and not the fact that wearing a mask protects your community. It's not all about you. But in the United States, that's the libertarian ethos, the idea of individualism has been just connected to liberty, and it's really damaging effects, as you can see. The other day, because people want the economy to open, a bunch of protesters were blocking people at Dodger Stadium who were lined up to try to get vaccines, saying, woo, you're overreacting and my freedom, I want everything to be open again. It's like, wait a minute. If they can't get vaccines, how can you open things up again? But the social bonds are very tattered in the United States. I think that's true in the UK as well. But I think, we need to start thinking about how we can get people to appreciate that they do better as part of a community rather than, using masks as a sign of, not wearing a mask as a sign of freedom when, you're free to kill your grandmother. I think we should also think about social safety as a legitimate public responsibility. Hiving everything off to the private sector hasn't worked. If you look at prisons, private hospitals, I think we need to rethink. And I think in COVID, a lot of places that it's shown that public services can actually step up to the plate where they've done it well. That the public sector isn't always a bad thing. During the Reagan and Thatcher just gets in the way, it distorts markets, but it can also help solve big problems. I think we should think about social safety as being a legitimate public responsibility. And as we've seen, massive mobilization as a pandemic response. And we've also, all this has been happening at a time of very divisive rising populism on the left and the right. And I think we've all witnessed increasing demonization of political actors. And I think a more positive way going forward is not really to demonize political actors, but take a really hard look at the rules. Look at the rules that undergird this system, this system that we've built of 21st century capitalism. There's a lot of the fundamental rules underneath that need to be changed because people are acting in accordance with the incentives that those rules provide, and they're resulting in very perverse outcomes and a lot of unnecessary death in this COVID situation. So there's this one economic bioethics, and really start thinking about how these structural changes like financialization and consolidation, how these intersect with medical research and practice. And we see a lot of examples in pharmaceutical field where there's 10 different versions of erectile dysfunction drugs or baldness drugs, and not a lot of things for tropical diseases. So the incentives, again, don't really match the needs. And so, but financialization, the blockbuster drugs, it's, you want to make drugs that rich people are going to buy. So that's what you get. And you don't get the ones that would help more people. And so I think it's important that we understand both the pathologies of 21st century capitalism and the opportunities going forward. So I just wanted to lay out kind of structural underpinnings, how these are manifest in different instances of dysfunction in the COVID pandemic, and how we might think about it differently going forward for better outcomes. And thank you for your attention.